Hi, I'm Kenny. I'm a community health outreach worker for the Frederick County Health Department's Communicable Disease and Prevention Program. I would like to talk to you about what HIV is, why it's important for people to be tested, and our HIV program here at the Health Department. HIV stands for Human Immunodeficiency Virus, which is a virus which attacks and destroys the immune system. This can lead people to have opportunistic infections, HIV-related cancer, as well as pneumonia that can lead to death. HIV is primarily a sexually transmitted disease and is passed through unprotected sex, meaning that no condoms were used. It's important to use condoms consistently and correctly every time. HIV can also be passed by sharing needles or having tattoos or piercings done with unsterilized needles. HIV can also be passed from mother to child during childbirth or breastfeeding. Treatment with antiretrovirals medication for expectant mothers can protect the baby and virtually eliminate this type of transmission. The Frederick County Health Department offers free rapid HIV testing, and you can schedule an appointment by calling 301-600-3342. I would now like to walk you through a typical HIV testing encounter and give you additional information on how you can protect yourself from getting HIV. The Fingerstick Test method that we use here at the Health Department only requires a small amount of blood to determine if someone has been infected with HIV. If a person has been exposed to HIV, their body creates antibodies to fight off the infection, and this test looks for those antibodies. If a person has recently been exposed to HIV, they may not have developed enough antibodies for the test to detect it. A counselor would determine if you should be retested at a future date and schedule you an appointment if needed. A counselor would then begin to ask questions about a person's risk factors. They may ask questions to see if you've had any early symptoms of an HIV infection, such as fevers, or night sweats, or rashes. But like many other sexually transmitted diseases, there may be no symptoms at all. And since there may be no symptoms, a person could be infected and unknowingly be passing the virus on to others. The CDC estimates that 1 in 8 people who are infected with HIV are unaware of their status. For those who do test positive, the health department will want to get a confirmatory test because sometimes it may be a false positive. And if confirmed, they will be linked to a healthcare provider to begin treatment. The Frederick County Health Department does offer treatment for all eligible clients. Treatments continue to improve and are offered at our on-site clinic by specialists from the Johns Hopkins Hospital. Case management services include obtaining healthcare insurance as well as prescription coverage, assessments and referral for preventative health, financial assistance for lab work, dental care, and vision screenings related to HIV. Interpreter services are also available for non-English speaking clients, and support groups are also available. Services are also available to inform sex and needle-sharing partners of those who test positive. Treatments for HIV continue to improve, and adherence to antiretroviral medications can reduce the amount of virus in a person's body to what they consider an undetectable level. This allows someone to live a normal, healthy life and also greatly reduces the chance that they can transmit the disease to others. PrEP and PEP are additional strategies used to prevent the spread of HIV. PrEP stands for pre-exposure prophylactics. It's a medication used to prevent an HIV infection before a possible exposure has happened and is recommended for people in high-risk populations. High-risk populations include those with an HIV sexual partner, those who are sharing needles, people with multiple sex partners who aren't using condoms consistently, as well as sex workers. The counselor can help determine if you are a good candidate for a PrEP prescription. PEP stands for post-exposure prophylactics, and it's a combination of medications used to prevent an HIV infection after a possible exposure has occurred. It must be started within a 72-hour period and the medication will be taken for 28 days for it to be effective. Identification and treatment of those who are HIV positive, along with the implementation of PrEP and PEP and correct and consistent condom use, are all strategies the Frederick Health Department uses to slow the spread of the HIV disease. Free HIV rapid testing and risk evaluation is provided here at our clinic, as well as with our community partners during outreach events and also through our mobile testing program. To find out when and where our next event is or to schedule an appointment, please call 301-600-3342. The Frederick County Health Department is committed to promote public health, prevent new HIV infections, and improve the lives of all those living with HIV.